Dr. Sunil. I am a consultant neurosurgeon and spine surgeon at Bhagwan Mahavir Jain Hospital, Bangalore. I have been doing a lot of neurosurgery cases since 2015. I have been associated with Jain Hospital from 2020 Jan.
So could you talk a little bit about your association with Dr. Sharan?
As I said, I have been associated with Dr. Sharan for last 1 year. So after coming here, I have seen a lot of neuro-modulation cases, baclofen pump insertions, pallidotomies for Parkinson's disease, and all those things which we have never done before. And I have seen a lot of good results also for these patients, which is excellent outcome. See, baclofen pumps are basically used for patients who have excessive spasticity. Spasticity in the sense, I mean like tightness of your upper limbs and lower limbs, as well as for certain disorders like dystonias and all those things. Usually these patients are neglected set of patients which are not seen by majority of neurosurgeons and neurologists. They just put them on plain medications and based upon their response, they are mostly neglected. But we have seen in our subset of patients, they get excellent results after insertion of baclofen pump. Especially they are able to walk, they are able to do their daily activities. The timing of surgery is utmost important because there is something called as golden hours in neurosurgery, both in neurology as well as neurosurgery. We have to operate certain set of patients within that specific period of time. If the patient gets beyond that time, even though we operate on the patients, the results will be very unfavorable. There might be sometimes death also if we are too much delayed in operating the patients. Apart from that, once the surgery is done, surgery is like one part, the rest part is aftercare, post-procedure care of the patient. Many of the patients might require tracheostomy, ventilator support, long-term ICU stay, rehab facilities, good physiotherapy, proper care of the skin, nutritional support. So these are all add-on factors which help in proper progression of the patient. Lack of awareness because most of our doctors themselves don't have this adequate knowledge of rehab facilities, physiotherapy, post-op care. Most of them have this feeling that surgery will take care of everything. No, it's not the thing. Surgery is just one part. There are many other aspects to the patient care apart from just surgery. But having said that, still surgery holds a very significant value in saving life of the patient. Definitely neuro rehab has a very critical role, crucial role in overall progress of the neurosurgical as well as neurological patients. We have seen patients improve a lot after this neuro rehab facility and specific physiotherapy. It's not like generalized physiotherapy which you give to patients. There are specific aspects, like for example, patients who have been tracheostomized, they should be given speech therapy, proper swallowing assessment has to be made to minimize the risk of aspiration. So most of these patients end up having aspiration. Aspiration in the sense patient swallows some food in the food pipe. Instead of food pipe, they take in the windpipe, what is called as trachea. And that will cause chest infection, and it is like a cycle. It's like a series of events. One thing leads to again deterioration of the patient, overall consciousness level comes down. Ultimately, will end up in ICU, and the costs keep adding up. So proper assessment is very important for these patients, and methodical evaluation and proper treatment is very essential.